Now, with the NHS coming under unprecedented strain this winter, nearly half of parents say that they don't feel confident about getting quick day-to-day medical care for their children. A poll by the website Mumsnet also found that a third were unable to get a GP appointment for their child in the previous 3 months. Well, I'm joined now by the Chair of the Royal College of GPs, Professor Kamila Hawthorne. Very good morning to you. Thanks so much for talking to us. First, perhaps it's useful for you to give us an idea of the kind of pressures that GPs are under. Give us a sense of what an average GP's working day looks like.
OK, I think first of all, I really wanted to say how sad we are to see these survey results, because we want parents to have confidence in the NHS and in NHS services. And certainly GPs and their teams pull out all the stops possible to see children, to make sure they get timely and appropriate care. So a GP's day nowadays is unbelievably busy. It's common for GPs to see between 40 and 60 patients in a day, which is really not sustainable and sometimes not very safe. I was talking to my brother-in-law yesterday, who is a GP in Farnham, and by tea time, he'd already dealt with 140 patients, which is way more than I've ever heard before. So it's a really, really busy, pressurized atmosphere. It starts at about 7:30 or 8 in the morning. It can often go on till 8 in the evening. GPs will then go home, have a quick bite to eat, and then get onto their laptops to do all the paperwork that's accumulated as a result of seeing all these patients. So it is, at the moment, we're working absolutely full tilt. Now, it isn't because GPs are not seeing patients because they don't want to. They really do want to, and it's a source of enormous frustration for us to feel that we're not able to do our job in the way that we would like to. And that's because there just aren't enough GPs due to years of underfunding and poor workforce planning. And in a way, the COVID pandemic, followed by strep A, followed by influenza, is just highlighting the nature of the problem.
So GPs are feeling stretched. According to this poll, a large number of people feel that they struggle to get an appointment for their children. So what's the solution?
Well, the solution really is to have a bigger workforce. You know, we need at least 6,000 more GPs. That's what the government manifesto said in 2019, to be delivered by 2024. So they're way behind on that because, in fact, the numbers of GPs are actually dropping. So we're now about 700 short of where we were 2 years ago. We're not increasing in numbers. And a lot of that is due to burnout and people leaving the profession early. And what we really need is better retention strategies for GPs, to keep people in the job and working, seeing patients in the way that they would like to do.
Well, yes, and in fact, in the Mumsnet poll, 86% said that they blamed the government for the crisis in the NHS. Do you agree then?
Yes, I think that it's been a number of factors, really. You can't blame the government for COVID-19 or for strep A, but those have really just highlighted the underlying shortage in workforce. And we've been warning the government about this for at least a decade, probably longer, that numbers of GPs were falling and that this was going to become a crisis. And also that in order to run a functioning health service, you need a robust general practice. You need to have a good primary care service. And there's very good evidence from across the world that countries that have a good functioning primary care service have a much healthier population.
We're seeing walkouts by nurses and ambulance staff. Is there a mood amongst GPs for industrial action? Do GPs want to strike?
No, I don't think they do at the moment. It's not really our function as a Royal Medical College to comment on terms and conditions of work. So it's not really within our remit to comment on this, and we wouldn't normally discuss it. But speaking anecdotally, I've not heard of a concerted move amongst GPs wanting to go on strike at the minute.
However, beyond the strikes amongst nurses and ambulance workers, do you think it's likely that we could see more widespread walkouts amongst other healthcare workers?
I think there is just so much pressure on healthcare staff right across the NHS. And it's really important that staff feel able to do their job properly to the standards that they're trained for and under the right conditions. And that is really, I think, what is underlying a lot of the dissent and discontent that we have currently.
And I wonder if you have a view on the ongoing dispute with the nurses. We have seen reported this morning by the Times newspaper that Pat Cullen, the head of the RCN, the nurses' union, saying that she might be prepared to meet the government halfway, would look at an offer of around 10%, even though the nurses' union has asked for 19% originally. What do you make of that, and do you feel that progress could be made?
I really hope so. I think no NHS worker wants to strike. It doesn't matter who or what you are within the NHS. Resolution is the best thing for everybody concerned, and of course, particularly for our patients. It's not for us to get into details of what this might look like, I'm afraid. But I think whatever happens, it's absolutely essential that we all work together to minimise the impact on patient safety.
Well, Professor Kamila Hawthorne, a chair of the Royal College of GPs, we really appreciate your time this morning. Thanks so much for talking to us.
Thank you.